Thank you all for being here today. My name is Emily Hawley, and I am the Executive Director of Iowa Forward, and we are very excited to announce our new campaign on behalf of all Iowans today. Like many Iowans, I wear many hats. I am a mother of a toddler, I'm a wife, I'm a professional, and I'm also a chronic pain warrior. I've had severe chronic pain for almost 24 years. Began with a mysterious infection when I was 10 years old, and that has defined the rest of my life. I share the concerns of all Iowans. I want better access to affordable health care. I want to be able to pay for my medications, and I want my taxes to be fair. And I want paid family leave for my friends and myself when it's time to take care of our children and our families. Right now, Iowans are inundated with politicians and policymakers traveling from river to river, talking at us when they should be listening. And that's why today, my colleagues and I have started Iowa Voices. It is a campaign to amplify the voices and concerns of Iowans, everyday Iowans. Regardless of age, race, gender, we all have the same concerns. We all want a better state for ourselves and for our children. We are working with our wonderful partners, Iowa Federation of Labor, Progress Iowa, among many others. We are a grassroots organization, and we are working towards a 6 to 7 figure campaign to fight on behalf of Iowans. We're demanding that policymakers like Senator Ernst take actions and positions that support all Iowans. For example, Iowa has the 21st most unfair state and local tax system in the country. I know that my taxes are too high, and I'm sure yours are as well. Senator Ernst promised that she would go to Washington and fight for Iowa families, and yet she supported the new tax law that gives huge tax breaks to corporations and the wealthiest 1% of the country, but raises taxes on regular, everyday Iowans. Also, 1.3 million Iowans, like myself, have pre-existing health conditions. Senator Ernst promised that she would go to Washington and protect us, but then she voted to allow insurance companies to charge those with pre-existing conditions more, or worse, allow insurance companies to not cover us at all. And that's unacceptable. It's time for Iowans to be heard. And today, we'll hear the experiences of two Iowans, Dr. Glenn Hurst and Rashawn Wilder. So right now, I'll bring up Dr. Glenn Hurst.
Thank you. Hello, thank you very much for allowing me to participate today. My name is Dr. Glenn Hurst. I am a primary care physician from Minden, Iowa, and I am a dying breed. I say that not because I am in a situation where I can't see enough patients or can't take care of the people around me, but because I'm being slowly suffocated and strangled by the system that we're forced to work in related to Medicare and Medicaid in rural Iowa. I'm not the only one who's suffering. We saw the closure of Carly Drug in Avoca, Iowa, which is a small community just to the east of my community. I've seen the closure of the clinic in Underwood, Iowa, which was actually a stopgap clinic run by a solo nurse practitioner, the people that we've tried to empower to help fill this gap that we see in primary care in our rural communities. I saw the clinic in Trainer close, which was an outreach clinic from one of the Council Bluffs communities. We're an incredibly diverse county in where I come from. Pottawatomie County is the second largest county in the state. We've got a urban community, Council Bluffs, in the southwest corner, and the rest of our county is all rural and rural communities. And I am the only practicing rural physician in that area. We have some physicians who will come out and do outreach clinics, but those don't last. We have a physician in Oakland who comes in from Omaha. Those physicians don't last either. We have a very unique practice, my practice, in that we live in the community that we serve. I do home visits for patients, which is unheard of anymore these days. I have a clinic in Council Bluffs, which is my outreach clinic for those people who use our community like a bedroom community and work in the Bluffs. That way they can still see their local doctor and their children, and they can share the same physician. I'm medical director at 4 nursing homes, 2 of them rural in our county, and have been a medical director of a hospice as well. So I've had my eyes on healthcare throughout our community and throughout our state. And we are suffering a slow, intentional death. When I say intentional, I mean that there is an intentional neglect going on in rural medicine to close our clinics, to limit the availability of our hospitals, to force us to move patients from the nursing homes in the communities where they lived and where their families and friends are all located, and shift them into the urban centers. This is part of the greater attack on rural America and rural Iowa specifically. This failed investment comes in many shapes. Obviously, it comes in a failed investment in the community itself. Healthcare industry is one of the top employers in our rural counties and in our urban counties as well. But in many of our rural counties, it's the #1 employer. So that's where money comes into our communities that then gets spent in the local grocery store or at the local pharmacy or the local restaurant. And each and every one of these rural communities that I serve have empty storefronts. And those storefronts aren't just the restaurant. They're not just the local quilting store. They're the physician's office. They're the physical therapy office and the chiropractor. For rent, for sale, forgotten. And we've got to find investment into our communities if we're going to survive. And what we're seeing is a cut of investment in our communities from the healthcare industry. Medicaid covers 25% of the cost of most healthcare provided in the rural setting. Medicaid provides 2/3 of the cost of long-term care in nursing homes in our communities. We saw Joni Ernst support a $1 trillion cut to Medicaid expenditures to the states, which will then lead to reduced coverage, reduced payment in these communities. We see less and less money flowing in, which means less and less viability to our communities. And don't confuse me with thinking Medicaid's a great deal. Medicaid pays $30 a day less than what it actually costs to take care of a patient in a nursing home. So we're already seeing cut funds and having to look in other places to find ways to pay for our care that we're providing. And ways we take care of that is by cutting costs. What's a great way to cut costs? Well, let's shift our money from the local pharmacy to a large multinational pharmacy that can provide drugs at a lower cost, and that undercuts our local pharmacy, and now we have another for rent sign on Main Street, USA. We also see a failure of investment in the quality of the care being provided to the people that we're responsible for. What I mean by that is we've seen the senator focus on providing opportunities for insurance companies to sell more plans that provide less care, these junk policies that don't meet all the requirements that were put into the ACA initially. These junk policies lead to money flowing out of our communities, not money back into our communities. It leads to less care, less protection for the people who need it the most. I had a patient who was at home with cerebral palsy, 50 years old, taken care of by his family in their home because they had services that came into the home. They had family members who adjusted their lives so that they were able to take care of this family member. And eventually, because of the changes to our healthcare system and the changes in payment, they were no longer able to get those services, and they could no longer afford to sacrifice their own insurance coverage by working part-time so they lose their insurance. They were no longer able to sacrifice that and continue taking care of this family member. This family member is now in a nursing home where they're getting the best care they can get. And I tell my patients, family members all the time, when you make those promises, I'm never going to put mom in a nursing home, I'm never going to put my brother with cerebral palsy in the nursing home, that's probably not a very realistic thing to say. You wouldn't have surgery on your kitchen table, right? You would go to a surgical suite. And on my way over here today, I thought, maybe I have to amend that a little bit. Because what if the surgical suite was so underfunded that it was dirty, that it was infectious, that there were used equipment that wasn't being cleaned? Would I send my family member to that place to have their knee replaced, to have their gallbladder out, when I know my kitchen table is cleaner? Probably not. And that's what people do. People keep their family member at home because they know that the quality investment is not there for their loved ones. Joni Ernst voted against expanding that quality in 2013 when she voted against expanding Medicaid in the state of Iowa when she served on the state senate. She's given no demonstration that she appreciates the impact that would have had we not expanded Medicaid. And so we really need to think about, are we holding people accountable for just that basic quality of care? And not just quality. What we're seeing is one more point, a loss of investment in the dignity of our family members and the people that we care for. Don't think that this isn't you. 70% of the people over the age of 65 will spend a portion of their life in long-term care in Iowa. 70%. 2/3 of that long-term care, as we said, is paid for by Medicaid. Who pays for the other part of that? You do, out of your pocket. Or perhaps you have a long-term care plan, which is rare and normally doesn't cover nearly enough. But eventually, you'll go through all of your money, and you will be the Medicaid patient as well. But don't kid yourselves, even if you're the private pay patient, there's no healthcare plan A and healthcare plan B in the nursing home. Everyone is treated and cared for in the same way. So you will share a room with another individual that you do not know. And you will be separated by a sheet as you sit on the commode in your nursing home room with your one personal item, which is probably the recliner that lifts your legs up so that you don't have too much edema in your feet. You will live at the dignity level that you have invested in your own health care. Minimum wage workers or low wage workers will be the ones who take care of your most personal needs. Your clothing will be changed, your bottom will be wiped, and your rashes and issues under body folds and breasts and groin will be applied by people who make less than the people who work at Burger King and McDonald's until they figure out that they can go there and have an easier job with better pay. So we are at a point where we have to ask ourselves, what are we going to do to invest in our communities? Where is the problem? Do we point our fingers at those nursing homes and say, you have to do more with less, when we already know they operate at a margin of 1%? Do we point our finger at them and say, you are responsible for the care of my mother? Well, my mother's voice rings in my ear when I say that. And my mother says, when you point that finger at someone else, remember that there are 3 fingers that point back at you. And the 3 fingers that point back at me are, am I holding my elected representative, Joni Ernst, responsible for the care of my community? Am I holding Joni Ernst responsible for the quality of the care in my community? And am I holding Joni Ernst responsible for the dignity of my friends and my family? I think the answer is that I have more work to do. Thank you very much.
Greetings. My name is Rashawn Wilder, and I'm currently employed full-time at the VA, and I also work part-time as a licensed social worker. Since arriving in Des Moines from Philadelphia some 10 years ago this July, I've obtained my associate's degree, my bachelor's degree, my master's degree, and have been licensed as a social worker and as a clinician here in the state of Iowa. However, my stay here in Iowa has not been without its challenges. While I became politically charged over affordable child care for my autistic daughter, Dashawn, I have since added the belief that she should have access to affordable health care. I stand before you specifically to talk about her pre-existing conditions and the cost of her medications. I am here to speak to why it is important for our elected officials, why it's important for our Senator Joni Ernst to keep her promise to protect people with pre-existing conditions. Dashawn, my joy, is 13 years old. I recently enrolled her in piano lessons, but she enjoys playing baseball in the summer and dancing to all sorts of music. And she also engages a lot in spiritually led events at my church. She's an usher. She's my only junior usher. But knowing these things about her, she also struggles with self-regulation. She struggles with aggression. She struggles with impulse control and conduct disorder. And oftentimes her ADHD takes her to places and events that sometimes causes disruption in her classroom setting and at home. More often, she struggles with self-control. Her inability to control her actions often manifests in forms of aggression towards others and property damage. Her temperament has caused her to be denied specific services or refused services because of the safety concerns for herself and her caregiver. Because of the level of aggression that she has is necessary for my child to be on a regimen of medications to help decrease the impulses. These meds are essential to her being successful throughout her day and throughout her life. In November of last year, unfortunately, her medical coverage had lapsed. And as a direct result of that, I was forced to pay $1,042 for just one of the 4 scripts that she takes regularly. This was a 30-day supply, and even with a master's degree, I had to make a decision as to how much medication I'm going to give her to last for the next couple of months until I can get her coverage back on. An educated woman with degrees to her name, to her credit, had to choose whether or not to medicate her daughter or feed her. This is not as previously mentioned, this is not something that I should have had to suffer through. My anxiety has often and has heightened over the recent changes to Iowa MCOs and my need to now choose a new carrier for my autistic daughter. See, with new carrier means I'm faced with the possibility of the new provider not covering or considering my child's pre-existing condition. I have to face the possibility of reduction or even loss of some of the required services for her. I'm in a position where I could potentially lose the medications that she necessarily needs right now, or that I may have to pay more for those same prescriptions based off of the formulary of the new MCO. I stand here today because I believe Senator Ernst promised that she would go to Washington to fight for Iowans, but instead she voted multiple times to repeal protections for people with pre-existing conditions like my daughter, like many of you are here. Conditions that they had no way of even protecting themselves. Senator Ernst says that she's concerned about Iowans like me and like my daughter. And she says that she's concerned about affordable medication for them, but she voted for tax breaks for wealthy drug companies. They got rewards, while Iowans like myself and others got nothing.
Thank you so much, Glenn and Rashawn. Iowa Voices, my colleagues and myself, we are so excited to travel around the state in the coming months and share the stories of everyday Iowans like Glenn and Rashawn. Their stories, my story, represents millions of other stories across the state, in rural communities, in urban communities, on farms and in cities. And we want to unite everyone behind the common mission of policies that will work for all Iowans and hold our leaders accountable for those policies. Thank you so much for being here today.